and welcome to Wisconsin. Just in case you don't get to visit us in person, the residents have put together a tour of our department to show off everywhere that you might be working in the future.
So this is our CT simulator. We are really fortunate here at UW to have awesome therapists to help set our patients up. We have all the technology that you can imagine, 4D CT, RPM gating, masks, molds, all that good stuff. And then really we're very fortunate to have attending to walk us through CT simulation, provide teaching points, and ultimately allow us to do CT simulations independently so that we can provide the best care for our patients in the future. And this is our brand new MR simulator that we are so excited to be launching later this month. We will use it lots for our SRS patients, our other brain patients, and then I think it will really provide an awesome boost for our brachytherapy program. So we are very pumped.
This is our dosimetry room. This is where the best and the brightest in the department are. They're always happy to help you out, teach you different beam angles for different plans or different radiation techniques. They also are a lot of fun. Every year they have an annual chili cook-off where each dosimetrist brings in a pot of chili and we all get to vote on which one's the best. One of our dosimetrists, Alex, is sitting right here. And the highlight of the dosimetry room is to show you another one of our dosimetrists has candy jars. So if there's ever a tough plan or a tough day, you're always welcome to come on back. Here's our physics wing. Our physicists are awesome. They're always happy to teach us. We have a physics course every summer, and everyone has their own office where you're always welcome. And in fact, if we go around the corner, we might see a few of them right now. 1, 2.
Physics! Hi, my name's Nick Grydewski. I'm one of the PGY4s here, and we're going on the tour through the clinic rooms now. These are where we'll see patients. Head and neck are most commonly seen on this side, and you see that we have a head and neck chair. We have 3 main head and neck rooms, and in all 3 rooms we have laryngoscopes, which are locked right now, but we'll, for every head and neck patient, we'll always do an exam, and if ever we're inspecting the larynx or any critical structures in that area, we'll do a scope, and so that will be a primary component of the clinic. We just have more patient rooms down here, and then if you follow me this way is where we have the nursing station and our planning rooms. So here is where all the nurses sit. The nurses can be a great help for your clinic day to day. And then past the nursing station, we have our 2 planning rooms. This is where we spend most of our time. So we will sit in here with our kind of the team that you're designated with for your rotation. Most of the time our attendings will sit with us. So this is Dr. Bassetti.
Hello.
And we'll spend our time kind of right next to our attendings, working together, and it's a great environment to be able to just ask any questions quickly and always get help out when you're doing contours or anything. Yeah, so we have multiple computers on this side, multiple computers on that side, and yeah, these are our 2 planning rooms.
Look at the treatment machines. So we have, this is one of our true beams. We have 2 true beams and 2 tomotherapy units. Each of our true beams has the Align RT system set up with it. And then we also have the ViewRay. The ViewRay, if you don't know what that is, it's a linear accelerator with onboard live MRI, so we can actually watch our patients as we treat them, watch their internal anatomy. So, yep, that's our machines. So, as I mentioned, we also have here a ViewRay machine, which is a linear accelerator attached to an MRI. And this is pretty useful because, as you can see here, this patient is under treatment right now. You can see their anatomy change. Actually, it's better visualized over here. you can actually see their anatomy change in real time as we're treating. And what we do is, this green guy here is something that the dosimetrist contoured that is tracked throughout the treatment. And when the tracking contour is within the PTV that was created, then the beam turns on and treats. So this allows us, you know, to have a smaller PTV, to treat less normal tissue, and ultimately to deliver a higher quality plan for our patients.
All right, I'll show you guys the resident office now. So in here we have workstations for all the residents. We also have a coffee maker and a fridge. Our chief residents have their own office back here. And then we've got a couch for relaxing. Our medical student computers are here. And then each resident is given a new MacBook Pro and a monitor to work on, and they can take that computer home to do any work that they need to at home or on the weekends. Yeah, so that's about it. We all sit back here early in the morning before we go into those treatment planning rooms where we work side by side with our attending physicians on service. All right, and this is our amazing front desk staff. They can help us get outside records, schedule appointments, set up outpatient consults with our patients when we need. They're here every day, 7:30 till 5:30 p.m.
Where did Greg go? Is Kettle Moraine north or south or?
All right.
I like how everyone's over there and everyone's just like.
You've got the hot.
This is our brachytherapy suite. We get experience with breast, prostate, lots of GYN, head and neck, and skin cancer brachytherapy. We particularly get a lot of use with multiple GYN applicators, and overall people leave our program feeling very confident in independently practicing brachytherapy. Multiple graduates have gone on to get jobs specifically for their skills in brachytherapy, so that's definitely a strength of our program.